Are we muted right now? Or are we just screaming?
We're just
business?
we're just screaming business at everybody. Yep.
And FYI, I'm going to be recording, like screen recording this. So this conversation will be available to folks who want it. Just reach out to Madison GDC at gmail.com if you want to get the recording. What, honey?
I see that, yeah, and I have to
Okay.
look it up.
Oh, in Wisconsin? It's like doubling every day. Yeah. Right. It's insane how much it's transferring.
Hello?
Hi.
Hey everyone. This is CV. I'm going to give people like 45 more seconds maybe to get onto the call, just so we don't have that like beeping sound when people join. How's everyone doing? Enjoying your social distancing fun times? All right, I'm gonna go ahead and get started. Like I said, I'm CV. There are probably too many of us to do introductions. There are currently 20 of us on right now, and I know that there are 6 GDC members who that is not counting since we're all on the same microphone at the moment. I just kind of want to, before we get started, let people know that there is an agenda that I linked on the Discord. If you do not have access to the Discord and you would like the agenda, just let me know and I can read the URL or I can post it in this little chat on the side. Actually, I'm going to just do that real quick, if that's all right with folks. Oh my God, it's so long. Okay.
That's okay.
All right, so Nick has just posted the link to the agenda in the little conversation tab, so we should be all set there. All right, so I just want to, give you all a little bit of an introduction to who we are at the GDC, since I know some of you, this is your first exposure to us. So we're the Madison General Defense Committee. We're a committee of the Industrial Workers of the World, which is a workplace organizing union that's global, as you might tell from the name. The General Defense Committee, or GDC, was founded primarily to help with strikes, to protect striking workers from the state, and to also organize mutual aid. And so in that vein, since we have not had any massive strikes in Wisconsin that we have been organizing with, of course there have been the nursing strikes and others that are ongoing that are awesome. But in the meantime, we've been doing a couple things around the community. So we do a free meal. You may have seen us at the top of State Street on Saturdays serving food there. And we also are involved with the bail funds, helping people get out of jail who are incarcerated. And also we're involved generally with community self-defense, doing workshops on, medical aid and other kind of like safety training and other defense training. So just to kind of give you a little bit of background, that's why we felt really compelled and like we had a good capacity and organizational structure to start organizing aid around the pandemic, just because we have been doing a lot of food support and other mutual aid to the community as it is. Before we kind of get off the ground, are there any like quick questions anyone has, or anything people want to get out there, so it's not just me talking for 10 minutes? All right, having heard nothing, I'm gonna.
Sorry.
Oh, go ahead. Sorry.
I guess my question was, I know that there are a lot of, I know there are a lot of different efforts that are going on, whether like it's a Facebook group or, for example, I work in the school district, so I know that individual schools are organizing like their own, drives and plans. And maybe you'll get to this, but how are you planning to kind of like interface with those other efforts, and what would be most helpful?
That's a great question. Some of the efforts, like individual neighborhood stuff, will be a little bit harder to interface with just because there's a lot of it going on. But so far, we have been in touch with the, National Planning? What's the NPC stand for? Northside Planning Committee, and a couple people from the school district and also the public health department. So we're organizing all of that right now through having a kind of a core subset of members and anyone else who wants to join on our Discord server, and then coordinating out of that home base by, calling people, having group chats as needed. I think it's definitely true that there are going to be some efforts that we're not collaborating with, but I think that's okay. I think this is going to be an ongoing thing and at the scale where we don't anticipate being able to meet everyone's needs. And so if there are multiple efforts that are reaching kind of different areas of Wisconsin or Madison or different people, I think that's okay.
Can I have this tea? This morning?
No problem. So the first thing that we wanted to do is that Tomas, who is here with us in the room, is just going to kind of give an overview on precautions to take to slow the spread and just things that we should be keeping in mind as we're going through mutual aid. And then after that, we're going to talk about sort of what we've organized so far and the different efforts you can get involved in. So I'm going to hand that over real quick.
Okay, hi everybody. So if I understand correctly, there is, I myself am a medical student. There should be another medical student, a nurse, and somebody trained in first response care. So in general, people, and from what I understand, a lot of people that have been volunteering are well informed about this, so use each other's resources, certain. But I kind of have just an overview in terms of how to approach the situation. So I think first and foremost to realize that this is an evolving situation. Like the Department of Public Health doesn't have a completely good handle on it, and also importantly, we have to make sure that we're not doing this the wrong way, because we have the potential to make it worse. If we are going to people's houses who have vulnerabilities to an infectious agent and we're not going about it the right way, we have a high chance or a higher chance of actually giving them the virus that we're trying to protect them from. So high caution, especially people that are going to be delivering needed resources to these people. So in general, let's say somebody calls in wants advice about what they should do, or how probable it is they actually have the infection. Generally, if they have symptoms and or have a contact that has symptoms and or they've been traveling recently, and that includes parts of the country that are known to be where the disease is known to be endemic, like in Seattle or New York or San Francisco, or outside of the country, those people should go into self-isolation and reduce as much exposure to anybody as possible, right? So the first order of business for somebody who suspects they might have the disease is to get tested, not to go into the emergency room. We want to hold going into the emergency room off until the last option. And basically, you do that if you have extreme shortness of breath, uncontrolled, very high fever, something where you would fear for your life. That's when you go into the emergency room. If you go in before that, you have the potential to.
He's saying to get tested.
If you don't have the disease, be exposed to it, and if you do have the disease, expose other people to it in the emergency room. Certainly avoid any public transportation. Again, just trying to minimize contacts and exposure. In general, the advice for keeping yourself safe, and the advice that you can give to people to keep themselves safe, is washing your hands frequently. If you can find a mask, wear it around people, and that includes if you're sick or if you're trying not to get sick. And it's true that if you're not trying not to get sick, it's not as effective, but I think there's a general sense that it can't hurt and it could potentially help. This virus not only can spread through coughs, but also just through like talking and being next to somebody. And so these the virus can live on surfaces for I think up to 24 hours. I heard. So you want to clean down surfaces that might have been exposed, as well as maintaining distance from somebody who might be infected. But in general, the first order of business is self-quarantine for somebody who suspects, and then getting tested after that.
Did you get my text, Amy?
The specific symptoms that people should be looking for are shortness of breath, fever, and cough, and wheezing. One thing we can tell people, like if they have a lot of congestion, like snot, that kind of thing, it's probably not coronavirus. That's not one of the symptoms. Also, making sure, so you can ask questions to people. Like, for instance, there on the thread, there was an idea about triaging over the phone. I think that's a great idea.
An hour left.
And some of the questions you can ask somebody if they're curious about what should I do? Do you think I have it? You should ask the questions: how long have you had this? Could this be something like seasonal allergies? What are the symptoms that you have? And then also, it's a good idea to, and like I said before, the first order of business is getting tested, right? So if somebody calls in and say, yeah, I don't know, I feel funny, and a lot of times people, the psychosomatic things, they can convince themselves they have these things. So if you want to say something like, I will take you down your information and I'll check in with you tomorrow. I'll look in for where we can get testing, and then I'll call you tomorrow and see how you're doing then. A lot of times it can get better by then, okay, no, they're not sick. If it's still suspicious, then you can start to, all right, no, we want to get you to get tested. So reassuring people, making sure they don't panic and go to the ED all of a sudden is something we want to make sure we are on top of. That is basically all the points that I have. I think what the Public Health Department of Madison, I believe I heard, is trying to come out with a plan by tomorrow in terms of getting people tested. That's what we're going to be looking at. Where can they get tested? How many tests? In general, there is a shortage of tests available. So who can get those tests is kind of on high suspicion of disease are the people that get those tests. We're going to be following what's coming out of the Public Health Department and any new developments from there. And just to reiterate, we want to be very careful about how we go about trying to help people, because we have the potential to make it worse. So use extreme caution. We have a limited amount of PPE, gloves, alcohol swabs. If you can find any, like masks, would be very nice to have. So just making sure, especially if you're making drop-offs, if you're going back and forth and back and forth and back and forth, your exposure is high. So making sure there's a filter between you, the package, and the person that you're giving it to, as much as possible, is the basic advice here. Are there any questions?
I have a question regarding masks, and since they're in short supply, would something like maybe just like wrapping a scarf around your face help with reducing contact?
I would not be able to say yes or no on that. I would imagine that it couldn't hurt, and it might potentially help, if only just to kind of remind you. So one of the things that masks do is they stop you from touching your face, which is one of the ways that you can get the virus. So like I was saying before, this virus can go through air. It's aerosolized, right? If somebody coughs, it's going to be in the air and you can breathe that in. But it also is on surfaces. So if you touch a surface and then that gets into your mouth, into your eyes, on your face, that's another way you can actually get it. So having a mask is protecting your face from yourself. Sometimes you just do it as a tick. I've been doing it consistently over the last day, and it's frustrating because how hard is it not to touch your face? But so like wearing something like a mask could help with that, I would imagine, as well. Yeah.
Tomas, this is Taryn, another med student, and I just wanted to speak to the mask issue as well. Just from everything I've been reading, with masks in short supply, it actually is not wise for folks to be using them unless they have symptoms or are in contact with people who have symptoms. Mm-hmm. So if we're able to, I think we should just be very thoughtful about supply of stuff right now. And absolutely, people who are preparing food, covering their faces while they're preparing food is very wise. But if there's a way that we can limit people's contact with each other at all, like leave food on doorsteps and just wait in the car and get a text when they have picked it up, that sort of thing, I think that'll be even more important than trying to find and use a very limited supply of masks for people who are already asymptomatic.
Okay, great. Yeah, thanks for bringing that up. Karen, right?
Yeah.
Yeah. Right. In general, maintaining a supply for the people that really need it. So don't hoard, right? Certainly don't hoard, and don't use it up when you don't need it. Does that sound about right?
Yeah, we'll surprise. Yeah.
Is there any other input, ideas, suggestions from anybody else? Questions?
Hey, this is Rachel. I've been doing dispatch, and I think Karen had some good points. And just so you know, we've been directing people to do some of that already. So, like wearing gloves. So if you're somebody who's doing transporting food, wearing gloves and then just dropping it off on people's porches or outside their buildings rather than direct contact with people.
I think it came up earlier in conversation about how, you're going to want to thank the person's going to want to thank you. You're going to want to have some kind of contact with them. I don't know, maybe you can leave a note or just text to, say thanks or say hope you're doing well. But limiting contact for sure.
Yeah, one thing that we did when we dropped off some food today was that we pre-wrote a note, like in a little postcard or something like that, that we were then able to just put in with the food, just to your point.
In addition, if folks who are planning on doing deliveries do not have personal protective equipment such as gloves or antiseptic wipes or anything like that, we can provide that for you. This is Anthony from the GDC.
All right. Are there any additional questions before we move on to the next item on the agenda? And obviously these conversations can be ongoing on the Discord as well. And if you are not linked up on the Discord, I'm going to ask Nick to also post the invite to the Discord in the conversation tab if you would like to join. The Discord, well, I'm going to talk more about that in 1 second. It is a little bit of a learning curve. If you use Slack, it'll be less of a learning curve. But it has been really efficient for us so far. So that link is now in the conversation tab. Okay. So as I mentioned, we're running our operations currently out of the Discord. The server was owned by Emily, but that is now transferred to me. So now I can kind of make the necessary changes, change people's roles, make people moderators, whatever we need going forward. There are currently, the way that it works is that, and those of you who have joined the Discord already know this, but when you join initially, it will take you to a page that kind of has general information to read first about what we have going on so far, and it'll also let you see the general chat and post in there, and then once I hear from people, just to make sure that they're real human beings, although I suppose someone could just lie or whatever, but then I grant them member access, and they can see basically all of the channels except for two, and I'll go over what those other channels are in 1 second. The two that most people can't see, but just to make you aware of, are the dispatch channels. The only reason most people can't see them is because they do have people's personal information, like addresses, and we do want to keep a tight control on, people are putting their real names and making very personal asks about things that they need right now, and I would feel really upset if I had asked for help and then it got broadcast to 40 people who didn't need to see it, and so we're just trying to keep some of that stuff under control. But if you request access to it, I will grant it to you. I'm not trying to this isn't an authoritarian situation. This is a horizontalist server. Anyone who wants access to things will be granted it unless there's a very good reason not to. So with that said, here's kind of what we have going on right now. And if you don't want to join the Discord, that's totally fine. You can just email us, and I'll just type or actually I'll have Nick, who I'm say all the things in the conversation tab right now. You can email us at madisongdc@gmail.com. And we'll get in touch with you that way, and we do have a group chat that's just text messages and stuff like that. So what we have going on right now, the first thing is, like I said, we have dispatch and case management, which is that when people fill out our form and ask for help, the case management people follow up with them. So call them or email them, ask what kind of help they need, and then they contact the necessary resources to set up whatever it is that people are asking for. The second thing we have is delivery and pickup, which is pretty self-explanatory. This is for people who are not showing symptoms, have not traveled in the last 30 days. Whoever's operating their microwave, I just want to let you know that we can't hear the beeping. Just FYI, you might want to mute your microphone. I assume it's a microwave. It sounds like one. So yeah, delivery and pickup, for people who haven't been in contact with anyone, are not showing symptoms. These are people who are literally picking up food and groceries and medications and taking them to people. As Tomas mentioned, we do have some pretty strict infection control protocols going for this. Don't make contact with anyone who are delivering stuff to. Leave it outside the door. They can send you a text message or an email to confirm that they got it, but it's not worth the risk of exposure. The third role is medical support. So things like when people, message us and either they need, prescriptions picked up, which really gets forwarded to delivery, or they have questions about, should I go to the hospital? Or, I'm having these symptoms. Is this consistent with what you know about coronavirus? So answering those sorts of questions. And then there's also fund distribution and accounting. So when people need, help, like, fortunately, Dane County has suspended evictions for a month and has said that they won't turn off people's water. I'm not sure about other utilities at this time, but there's still people, people still need money for various things. So we have a finances account that sort of everyone can see, but not everyone can post in, where we're just very transparently saying, I spent $50 on this, or we transferred $100 for this purpose. Just because you all deserve to know where the money's going. A lot of you have also donated money in addition to your labor, but either way, you deserve to know how we're running things, because y'all have been very, very kind and generous with what you've got. The other thing is housing and utility forgiveness. So this is mostly connecting people to resources. So there have been several people around town, the Tenant Resource Center and also another legal center, that are offering people help if they have eviction notices. Also, what we can do is contact people's landlords and talk to them, or connect them to other kinds of resources that they might need at this time. We can convey information, like, for example, we do know that their water won't be shut off, so if people are really worried about paying their water bill, we can at least reassure them of those kinds of things. But yeah, the housing and utilities folks are generally connecting people to additional resources that they could potentially need. It's very much a knowledge-based operation, so it requires people who are there to like do some research, find out what's available, so that they can convey that to either dispatchers, or people can call you, or rather you would call them. Dispatch would ask you to call them at a certain time, and talk to them about their housing needs. A couple more things. So we have volunteer outreach and coordination. So posting on social media, coordinating the volunteers who are not on the Discord. There definitely are a fair number of people who are not on Discord because, for whatever reason it's difficult to use, or, they don't want to, which is totally fine. So coordinating volunteers generally, this is another really good if you're quarantined or in social isolation. And then two more. I'm so sorry. I know there are a lot of roles. Thank you all for bearing with me while I talk for a bunch of minutes. Food security. So again, this is one of those roles that we're very strict on. You can't be showing symptoms. You can't, have been around anyone who tested positive, or even anyone who is showing symptoms. You can't have traveled for 30 days. This is preparing food for people. There's like nothing better than like a nice home cooked meal when you're feeling sick. But this is something that we're going to ask people to be, your kitchen's going to need to be sterilized in between times when you're cooking, all that kind of stuff. And then, you'll put that food out for delivery people. They'll grab it from you and they'll take it to where we need to go. Adria, I see your question. I will answer it in 1 second. And then the last thing that we have going on right now is the emotional support network. So again, another great one for people under social isolation or who are quarantined. A lot of people are really lonely. They might have mental health issues and needs. They may just be elderly, and like now their connection to their families that keep them going is cut off all of a sudden. So people just need someone to call them and like talk to them. 15, 20 minutes, an hour, whatever it might be, really goes a long way in helping people weather this, because it is really difficult to be socially isolated. So that emotional support channel is the other thing. We also have combined the fundraising with the volunteer coordination, because I'm not sure that will be a full-time. Either of those will be full-time, but if you're good at fundraising, honestly, we could super use the help there. We have way more requests than are easily funded. We've been managing pretty well so far, but it would be great to have, it would always be great to have more funds to work with. To answer Adria's question, so yes, Dane County has what is now apparently a $277,000 emergency fund, which is awesome. What I have heard so far is that they have no plan for how to use that or distribute it. I haven't done much more other than make a Facebook status that's like, it'd be sweet if they toss some of that our way. But I don't know how to actually ask the people who would be able to do that if that's something they would be willing to do. But that would be a great thing for our fundraising team to do, is talk to them about potentially getting some of that. I mean, even right now we've operated, I think, so far with like $3,000, maybe less than that. And we've managed to do a pretty good job, but we have, I think right now, 75 responses on the form. We've got through maybe 20 of those. So yeah, we could definitely, a couple thousand more dollars would really help us like get through what we have right now. And, you know, as Tomas also mentioned, this is the beginning. We're getting out ahead of this right now. Things will get much worse, I imagine, or at least much more severe and urgent as things go on. And so the more money we have, the better we can mobilize, obviously. We also have a couple efforts we would like to start. In particular, so no one can figure out how to do childcare safely. If anyone has ideas on that, we would take it. Right now, our approach is that people who are like, I need childcare, we're probably going to tell them, take a day off from work. We'll try to give you money to replace the lost wages and just stay home and socially isolated, because whoever goes into a childcare capacity is basically, we're assuming at that point that they're infected, and we're assuming that they're going to infect the family. So we would really rather not do that. But also people's needs are going to be complicated. And so we are open to kind of hearing other things about that. The other thing is jail clemency and pardons. Prisons are going to be a real hotspot for pandemic activity. We have had Wisconsin prisons be on lockdown just for the flu already this year, and so I would anticipate that this is going to follow a similar trajectory of everyone in the prisons getting sick. We do want to allocate some funds, transferring money to prisoners to be able to buy soap, because that's a thing that they make you do in Wisconsin prisons. So far, they have not done anything to provide prisoners with the means to wash their hands adequately with antimicrobial soap. So we want to make sure that we're supporting those folks as well. I know there was a ton of information to throw at you all. Is there any questions about that so far? And I just want to let you know with the knowledge that the next thing on the agenda is Nick or Megan, who were on that call with the Northside Planning Committee, who have a bunch of additional resources available to us now, are going to tell us about that. But any questions about what I just said? All right, excellent. In that case, Nick or Megan, whichever of you would like to kind of let people know what we found out on the earlier phone call.
I can just kind of announce if there's anything that you want to go over, you can.
Yeah, so this is Nick here with the GDC. Going to hand it off to Megan in a second. I want to say also that I think maybe one or two other people that are in the Skype call were in on this meeting. I know Rachel was as well. So maybe after Megan gives her piece, we can, if other people want to add into that, that would be good.
All right, so I'm just going to give a quick rundown. We had a initial kind of kickoff meeting with the Northside Madison Planning Commission. They were looking to find out what the different groups that are organizing were hearing, what they've done to date, what they're looking to do, and what assets and resources folks had. There are about 20 to 30 people in attendance there. So Nick was able to give a good rundown of what the GDC has been able to do thus far, which CV just gave us kind of a great overview of anyway, so I'll skip that. We had someone from the Dane County Time Bank. They're working to expedite their new member sign up and turn it into an online process so that they can get people up and running and sharing resources and time in both directions. They're also potentially looking at ways to interject financial compensation into the system, from the sounds of it, due to the fact that individuals need income at this time. They're also highly active in restorative justice. They're working on transportation. Start Dane County Neighbors Helping Neighbors, which is resources, information, and people. People looking to. Thanks, Liam. I'll give it a second here and maybe slow down. Dane County Neighbors Helping Neighbors is a Facebook group looking to connect resources, information, and people. People trying to locate diapers. Has anybody seen it? People with extra resources like tomatoes or other kitchen goods or cleaning supplies. People looking for infant formula. Like that, and allowing them to kind of coordinate, like a Facebook marketplace for trading goods and favors a little more privately. One of the big concerns that was brought up, though, was getting information and resources to people who don't have access to Facebook, Twitter, Discord, or Nextdoor. How do we let our neighbors know what we're doing and what's going on, and that these resources are available? There's some talk about potentially setting up a hotline with the Northside Planning Committee and looking for volunteers to staff that line for an hour or two at a time between certain hours in the day, and getting that number out into the community so people can direct folks to the appropriate resources for what they're looking for. Obviously, that would take creating a pretty detailed list of what's available, but that's also well underway thanks to individuals out in the community. Mutual Aid Workspace and the Social Justice Center are going to be doing daily Zoom and in-person meetings to discuss and attempt to meet needs. They'll have a dry erase board in their entry with people looking for stuff and with offers, and are working on infrastructure to create infrastructure for better communications. Let's see. There are a couple of things going on that we will get posted out in the Discord pretty quickly here tomorrow. Kennedy Heights Community Center needs help packaging food at their pantry tomorrow morning at 7:30 a.m. They said volunteers can just show up. And then Brett, that's not a terrible idea, and that's actually really good. I'll get to that. Brett, about spreading the word using magazines and papers or sending mail. We have a gentleman that was in that meeting from the Boys and Girls Club and also part of Madison 365, and they want to help communicate what's going on. Imagine they'll be able to help us out with stuff like that. I know there are other local communications that would probably be willing to give us, and when I say us, I mean not only the GDC, but this entire planning meeting and the organization involved with it, some space to talk about what they're doing. Adria, that's also a good idea. Reaching out to coordinators of local churches. And then real quick, I apologize. Mendota Elementary School is looking to distribute their remaining food and snacks from 3 to 5 p.m. tomorrow. If you know anyone looking for stuff, that's a great opportunity for people to go get stuff for their children. We'll get that up in the Discord as well, and potentially out on our Facebook. And that's pretty much the summary of what the meeting was about. I don't know if Nick has anything else they'd like to add.
Look at the size of the other groups.
I kind of missed that in the notes.
Yeah,
I'm gonna pass to Nick real quick.
Yeah, just one thing I wanted to throw in quickly is I didn't realize the scope and scale of some of the other efforts that are organizing around town. And so there's Neighbor to Neighbor, I think is what it's called. They have something like 2,200 people that are either involved in like offering to volunteer or requesting help. It wasn't super clear to me which. And then there's another group, the Madison Mutual Aid, and they have about 900 people who have like signed up into their stuff, which is pretty sizable compared with what we're working with at this point in time. So I'd be curious to see if coordinating with them could maybe cover some of, get us some greater coverage in what we're doing, and so we're not stretching ourselves too thin, and we're combining resources and stuff like that. So that's pretty much all I have to add on that.
Okay. And then Rachel, do you want to talk about the stuff you're working on specifically?
Yeah, so currently there's an order that utilities will not be shut off during the health emergency. So as we're making calls, we've been just reassuring people of that. But the plan is that people are still getting billed. And so if you are out of work for 2 weeks or a month, then it just means that you're going to have a higher bill in April than you are, it's not really solving anything. So trying to convince MG&E to just not to do payment forgiveness. So just not charging people if they're in mass quarantines, if people are losing work because of this. So at this point, I've just started like some basic calls. I think one of the next steps is to put some community support on them. So folks that were on that call, either through the Northside Planning Council, seems like they're willing to all write letters of support. So I think that those are some of the next steps on that. It's more, if people are interested in getting involved in some way, just reach out to me directly. Or maybe put your info in that chat box.
All right. Thank you. Does anyone have any questions for regarding anything?
Hey, yeah, sorry. This is Julia with the Madison COVID-19 Mutual Aid Facebook group. That 900 figure and the 2100 figure, people just joined the Facebook group, which is like not very hard to do. So it's not like there's like 900 people like currently volunteering with us or anything like that. That being said, that is like a scope and a reach in terms of like telling people about what y'all are doing. And so our main goal with that page, it's still in flux. There's these 2 pages. It's still in flux about what our main goal will be. But anyway, any ideas that you all have about how to make our page and accompanying Google Sheet as useful to your efforts as possible would be totally welcome. Yeah.
All right. Thank you very much, Julia. And there's reciprocity there as well. We're down to help however we can with what's going on in your Facebook group. And I think Anthony has something to say here.
Yeah, I'm wondering if a good next step for anybody on this call, and particularly folks who are tapped into large social networks, would be to put out a call for fundraising with regard to this effort. So particularly if folks would be willing to share on their various networks the PayPal for this effort, which is the PayPal is Madison GDC@gmail.com, and we're still using your Venmo. Okay. So the PayPal is Madison GDC@gmail.com, and the Venmo is CV-Adad, and we're going to drop that in the chat.
Hey Nick, would you mind typing the PayPal and Venmo? Thank you. All right, so we'll get that in the conversation. So Liam says, can we talk quick about the work we've done so far? Deliveries and the things we've distributed. Yes, absolutely. So far, I don't have all of the things on the top of my head in terms of, like we went to a family of 4 and gave this much food. But I do know that so far we've done over a dozen various food drops. Anthony has been awesome coordinating a ton of those deliveries. Rachel, and there have been a couple people as well. I'm sorry that I don't have everyone's names committed to memory quite yet, but Rachel's been doing a ton of dispatch, and that's been really awesome. We've talked to a couple people and provided some limited emotional support, but that's just getting off the ground right now, so not as much there. We've also distributed about $650. It might be a little more than that in like just direct cash aid that doesn't include the money we've spent like on food and things like that so far. So that's kind of what we've done to this point. Are there any questions about that? There's just a couple more things, not very much, maybe like 10 more minutes. We'll all be off this by 7, but are there any questions? All right, awesome. The last thing I want to do, sorry, go ahead.
Yeah, as far as like food prep prior to delivery, what would be a good way to estimate how much food to make at a time for how many people? Because I'm not sure, like, it's not clear to me what, like, how many people are involved in like preparing food, like what the scalability of it is, and it wouldn't make sense to like make more than is necessary and have food go bad, of course. So I'm curious if you have any thoughts on that.
Yeah, absolutely. So I would say that we are at a 0% risk of having too much food for what that is worth. Right now, you know, we're providing people with like a couple of those big plastic cylinders like you would get like super curry in, the like 32 ounces. We're providing people with like 2 of those, but we've also got people who are like families of 6, families of 4, and so we are definitely not at risk of having too much food. I would say in general what we've been doing is having people who are willing to prepare food, basically like make a nice big pot of something, whatever you feel like is reasonable, and then you can either, if you have containers, that's awesome. I will bring you containers and you can package the food and then give it back to me. And, you know, I'm kind of centralizing food at my place so that people who are delivering don't have to go to like a bunch of different random places around Madison. Or you can kind of bring the food to me. I will take the pot into my apartment, package it into containers, and then re-put it back out there, you know, following adequate, like we're not going to touch each other or hang around each other, but sort of like this weird dance of transferring materials back and forth. But yeah, I would say like make a nice big pot of something or whatever you can do. You know, if you can do less than that, every little bit helps. Even one meal for one family for one night is really something to be proud of. So, you know, whatever you feel comfortable making.
All right, cool. Thank you for clarifying.
This is
Hey, I'm
Megan.
not sure if y'all can hear. Oh.
Go ahead and then I'll jump in.
Yeah, I have a question real quick about just like coordinating all of the documents. I'm wondering if, this is Sammy, I'm wondering if it would be helpful to create a shared drive where we can just kind of hold, if we're going to be making protocol for each of these things, if it would be helpful to have different folders for people who are within the different realms so that they can go to that specific thing and just kind of have it all live there, or if you want to just keep it in separate documents and spreadsheets and stuff.
That's such a good idea. Oh my God. Yes, we should do that.
Okay.
So
I can work on that for you all.
For what it's worth,
If that's helpful.
yes, it is definitely helpful. Link up with Nick, who says that they have started a drive, and you all can kind of maybe start coordinating and putting that all in one place, and then we can get the link up. You know, the only thing I would say, obviously, is like just be careful with the dispatch notes that have people's personal info in them, but we've already kind of established that, and we can keep that one as like a pinned message at the top of the dispatch channel so that it's easily accessible, and then put everything else in the drive.
Awesome. Sounds good. Thank you.
Okay. Real quick, I want to jump back to the question about food prep. One of the things that I overlooked in the notes I took on the Northside Planning Council meeting is Northside Planning Council does own feed kitchens. So they have quite a scalable space for food prep, and they are looking at ways to use that to make large meals, get it prepped, packaged, and draw, like either delivered or arrange pickup so people can get their stuff and go home. So there is potential for that. But again, I don't think anyone has any concerns about there being too much and there being any waste. And honestly, with what we do as far as free meal on the weekend, food disappears really fast with whatever goes on.
To answer the question Amanda just asked in the conversation tab about contacting people, yeah, if someone has not been assigned to someone yet, that means that it's up for grabs. So if you're a dispatcher and you're looking, at the sheet and you're like, oh, I could contact this person, go for it. Just put your name there and claim it.
Pass to Anthony real quick.
Yeah, I think one thing to also keep in mind, it seems like recently we've had an influx of people who are able to make deliveries and far significantly less folks who are able to prep food. So if we're thinking about our balance here, we could definitely use more support around prepping food and also doing potentially grocery runs in addition to deliveries. It seems like we have a lot of folks who are who have access to vehicles who are willing and able to do deliveries. It's more about there seems to be a little bit more of a growing need for prep of that food.
Awesome.
When you say prep, you mean actually like making the food, yeah?
Yeah.
Or just simply collecting the supplies or acquiring it too, which
right.
We're talking about trying to have that. We're talking about trying to have that largely centralized at CV's place if possible, but also to say that if you're able to prep or to collect food items or other items that are high need like diapers or formula, that's definitely something that we need as well.
Yeah, and we will Venmo you money for that. So if you're, if you're like waiting on a delivery, even just asking, you can dispatch in the delivery channel and just say, are there items we need to have on hand? And we'll Venmo you money. And if you could pick up like diapers, baby wipes, those sorts of things, that would be a tremendous help.
Yeah, and one tactic that folks who have been doing deliveries have done is, for those of us who are willing and able to, in lieu of just donating directly to the GDC funds, what I know I've done and a few others who are doing deliveries have said, I'll cover whatever difference is between what money is Venmo to me by the GDC and what whatever the food cost that I'm getting, because a lot of the times what we're doing is filling grocery orders for folks, and sometimes folks are giving us money for that or reimbursing, sometimes the GDC is covering it. It really just depends on what folks' needs are. So if you feel like, hey, I know I'm going to be doing a bunch of deliveries, it might be worthwhile to hold off on donating some money and just covering whatever the difference might be on a grocery run or whatever there too, and that's a really viable option for folks.
Thank you.
And I guess to understand the process better, my name is Michaela. So, how is that call made as far as, is it mostly just kind of taking people at their word about the needs that they have, or is there, a certain way that they're scaling for the number of people in their household, or scaling it against the resources that are available? Who makes that call and how do they make it?
So we are taking people at their word right now because of the high volume. We're trying to allocate no more than $100 to a household. We did earlier today give someone $117 because that's what they needed to pay their health insurance, and God knows people need to have health insurance right now. So we have a little bit of flexibility, but that's about where we're trying to keep the cap. But yeah, we're just trusting people, and that's the best we can do.
Sure.
Okay, so Bree asked, where's the responses sheet currently viewable? Right now, that's something that the dispatchers have access to, so just tag me, just at CV, and my name should pop up, and just say, can you make me a dispatcher, and I will do that, and you'll be able to see that. As I mentioned before, the sheet is currently unlocked, but that means that it basically is only posted in the dispatcher's channel because, again, it does have private and personal information, and so we just don't want it to be wider than it has to be. But you can also ask dispatch what they need by tagging @dispatch, and that will tag all of the dispatchers. On that note, if you have a specific thing that you're interested in doing, please let me know and I'll add the tag. So like if you're interested specifically in medical stuff, I'll tag you as medical, and then people can @medical and you will be one of the people tagged. Same with food prep. There's obviously a channel for it, but you can also tag yourself or ask me to tag you as food prep, and then people can @food prep and we'll all get the notification. So just FYI. The other quick thing about the Discord server, I just want to like let you know a couple channels, like protocol for posting in them. The general chat, please talk about whatever you would like to. If it gets like really busy, we might make like a social chat just for like random stuff that people want to talk about, which would also be totally fine. The only other one that's really like tightly controlled is the delivery coordination one. For obvious reasons, don't put anything in there that doesn't absolutely have to be. Right now, the dispatchers are doing @everyone, which tags everyone on the server. It'll send you an email as well and let you know that you've been tagged in something. Where it's like @everyone, here's a dispatch request, this is what we need, this is when they're available. Most people are available all the time because they're in social isolation or social, whatever we're calling it, avoidance. So that's the only channel that, like, please be careful about what you post in it, because the worst thing that could happen is dispatchers make a request for something and then other messages bump it up and so nobody sees it. Obviously, we will send out a dispatch more than once if that happens, but please, just be aware of that. Mia just asked which roles are appropriate for folks in social isolation. If you're on the Discord in the Read This First channel, I did post kind of like an overview of what roles are appropriate, but just to remind you all, roles appropriate for people in social isolation are dispatching and case management, also emotional support, that's all done over the phone, fundraising and volunteer coordination, and then also housing and utilities. All of those are things that are just like over the internet and over phone contacting people.
And I think one thing to clarify, if you are in the delivery coordination channel and you want to fulfill a request that is put out by dispatch, the way to go about doing that is to respond to that request with a thumbs up in the chat, and the dispatcher will reach out to you and provide more detail.
If you can't figure out how to do the emoji, obviously feel free to be like, I'll take, like quote it or say, I'll take this one, and then they'll reach out to you. But if you hover over the message or on a phone, if you like hold down, tap on the message and hold down, it should give you emojis. If you can't get to the thumbs up, any emoji will do. We'll assume that that means that you'd like to take that one. I know this has been a ton of information. I'm really grateful for you all, especially the people who I've literally never met before who have all signed on to help. Has been super awesome. Okay, so if there are any questions, let me know. And then before we hop off, Liam just sent a message to the conversation that someone wants to talk about something but needs to download the app and get on here. But in the meantime, are there any questions as we're kind of starting to wind down?
I don't know. This is Jeannie Erickson speaking to you here. Am I on with you?
Yeah, you're good, Jean.
Oh, cool. I'm Jeannie Erickson. As I said, I'm the director of Project GDC. I came into the conversation late because I got tied up looking for supplies for what we need. But I just wanted to let people know that we are out there. We do have an active Facebook page, and it's connected also with the Today Not Tomorrow Family Resource Center. What Project Babies is attempting to do is to provide as much diapers and wipes and other supplies that we can to some larger areas. We have been supplying like the Beacon since the day that they opened with all of their baby supplies. So we've got 7 different baby closets around the greater Madison area. And then we also deliver to individuals. So we're going to be in need of a lot more diapers and wipes, which are right now impossible to find in the city at a reasonable price. And if we can kind of coordinate some efforts that way, as far as people with donations for diapers, then we can help distribute. I just would like to have another conversation about that whole process, being that it can be quite complex, given the current situation that we're in.
Would it be helpful if I created a kids and families channel, and then you could coordinate that out of that channel?
Sure. I certainly can. I'm pretty computer savvy. I mean, I've got in on Discord right now. I just couldn't find the spreadsheet that you were talking about. Somebody sent me a link, so I now see where you're at. So in
Welcome to the audio conferencing center. Please enter a conference ID followed by pound. To continue in English, press 1. Para español, presione 2. To continue in English, press 1. Welcome to the audio conferencing center. Please enter a conference ID followed by pound. Sorry, I didn't get that. Please enter a conference ID and then press pound. Sorry, I didn't get that. Please enter a conference ID and then press pound. You are now joining the meeting.
Versus not committing to cooking for 10 people and then bringing it to them.
Okay, so what if I was more of the, I heard you say earlier, like people, you need more food prep. So if I do that, am I just prepping whatever, like I know how to really quick make a vegetable soup in a big quantity, and I prepare it and then coordinate getting that to you? Or do I wait until someone says we need a vegan meal or a vegetable soup meal or something like that? Like, what's the order? Are you just stockpiling it because it's going fast? Or does someone make a specific request for something?
So at this time, I am just piling it because it's going quickly. I mean, I made like 25 containers of food, and we're down to like 5 of them. And so I'm about to actually cook more after this conference call is over. But yeah, just make a pot of whatever you make well, and I'm sure people will be very grateful for it. The only thing is, please, you don't have to mark it, but write down for me whatever is in it in terms of allergens, so that I can, make sure that we're giving people things that they can actually eat.
And where do you actually store that? Do you have a huge refrigerator or what?
It's not a huge refrigerator, but it's a refrigerator that's big enough right now and with enough GDC members who live within a couple blocks of me who meet the criteria for food prep, who are asymptomatic, haven't traveled, haven't been in contact with anyone, to overflow into their fridges as needed. If it becomes an issue, then I will definitely post in the food prep channel and look for other people's help there.
Okay.
All right, thanks for clarifying.
I had a quick point to make about the whole food prep thing. Just to reiterate, we have to be very careful about how we go about delivering to these houses and what we're delivering. So if you are going to prep meals and or deliver those meals, you just got to be sure to follow pretty tight protocol in terms of wiping down surfaces. You know, just got to be careful about that. Just to reiterate.
Is there like a set of guidelines somewhere that is available, or is it really more like just be exceedingly cautious type of situation?
I'm sorry, 1 second, please.
We're going to add those protocols to the various channels.
Okay, so the plan is to add the protocols to the various channels tonight.
Great, thank you.
Yeah, and they'll also, all of the protocols for everything will be stored in the Google Doc so that people who are not in the, or in the Google Drive rather, so people who are not in the Discord will be able to go to the Google Drive, which will email out to everyone who has filled out the volunteer form so that they have access to those things. But yeah, we'll try to get all those protocols up by tonight and let everyone know where they're located.
Okay, thank you.
All right, if there's not anything else from anyone, I'm going to go ahead and say that this phone call has been a wonderful success. Thank you all so much for being the amazing humans that you are. And we can all go ahead and get back to our nights. Just, you know, check the Discord, email us if you need anything, and otherwise we will coordinate appropriately.
One last thing, everyone remember, self-care is important. Take time for yourself in all this. Make sure you're taking breaks. I know there are a lot of people working really hard at everything they're doing to take care of their neighbors, but if you're not taking care of yourself, you're not going to be able to take care of people down the road. So please do that. And with that, everyone have a wonderful night.
Thank you.
All right, take care. Bye.